I'm Dr. Taylor Gregory, the VP of Animal Health and Veterinarian here at the Greensboro Science Center. And last week we took one of our servals, Kira, down here to the hospital for an annual exam as well as reproductive exam. For Kira, we started with an IM injection or intramuscular injection of an anesthetic to help her fall asleep. And then once she was asleep, we pulled her out of her enclosure and then got some monitoring on this. Started by placing an endotracheal tube in her trachea to protect her airway. And then at the end of that, we placed a capnograph, which monitors her CO2 as well as her respiratory rate. From there, we placed an EKG, which is a heart rate monitor, as well as a heart rhythm monitor, and an SpO2 monitor, which monitors the percent of oxygen she has in her blood. We also had a BP or blood pressure monitor on her, as well as a temperature monitor. Animal exams here at the Greensboro Science Center are a team effort. For Kira's exam, we had our wonderful veterinary assistant, Mackenzie, and then we brought in a visiting veterinarian, Dr. Andrew Miller, who came in to just lend a helping hand. All physicals exams start with a basic exam, which consists of looking at her ears, looking at her eyes, and looking at her mouth. From then, we move on to looking at the rest of her body. This includes palpating all of her joints and all of her legs, making sure they all move normally, and then palpating her abdomen. We're looking to make sure there's no abnormally sized organs and everything feels nice and smooth. There's nothing weird inside her abdominal cavity. It gives us a very basic first look, and then we can take a deeper dive with radiographs. For radiographs in an animal like Kira, what we do is we move into our radiology suite and then we position her. So radiographs are taken in different positions on different sides of the animal. So we'll put her in a lateral position and then we'll put her in a dorsal position. So one on her side, one on her back, and then we take images of certain areas of her body to get different views that then we can then take a look at later and compare to previous views of her body to make sure nothing's changed on the inside. And then when we're taking the radiograph, since radiographs do use radiation, we either gown up or we step out of the room when we're taking that radiograph. As part of her exam this time, Kira did get a reproductive ultrasound, and so what we were looking for were any abnormalities that would make her reproductive tract stand out, as well as looking at everything else in her abdomen for just more of a deeper dive to her abdominal cavity. So when we ultrasounded her abdominal cavity and her reproductive tract, we didn't see any abnormalities. So we're happy with what her reproductive tract and her abdominal cavity look like health-wise. When we have an animal under anesthesia, we look at their teeth to see if there's any debris that we can remove, and Kira had just a small amount, so we went ahead and removed that while she was under. Sometimes when our animals are under anesthesia, our keepers ask if we're able to make paw prints of them as little keepsakes for our keepers. And so when we can and it is safe to do so, and we have the extra hands to do so, we're willing to do that because our keepers spend quite a lot of time working with these animals, and it's a nice way for us as the vet staff to give back to them. As she starts to wake up, we give her a little bit of stimulation by adding some noise and some tapping on the crate that she's in. And then once she's able to swallow, we'll take that endotracheal tube that we put in to protect her trachea out because she no longer needs it. She can swallow and breathe on her own. And then as she's waking up, she still feels some effects of those drugs, so her pupils will be really big, which is completely normal. That'll wear off over time. And then we keep her in the hospital for a little bit longer until she's able to stand on her own and is looking up and is back to her normal feisty self. And then she heads back with the keepers to continue her recovery back home where she's more comfortable and it's her safe place. Overall, on her exam, Kira looked to be very healthy, so I'm very happy with how she did under anesthesia and how all of her results came back.